few minutes. Maybe we'll start with the other topics on the agenda.
Okay. Yes. Okay. Shall we start, sir, then?
Yeah, whenever you're ready.
Yes.
The other channel is also open now?
Yes. I just on the YouTube. So now we are there. So YouTube live already start.
Thank you, Arshal.
Can we start?
Yes.
Okay.
Whenever you want me to share my presentation, just make me the host, so I'll be able to connect.
Okay. Sure. Yeah, I already allowed. So yes. So good evening. I will just check with the YouTube, and then we can maybe start. Okay. Yes, we are good. So hi all. Good evening, everyone. Thank you for being here for this particular session. As you know, we are talking about COVID-19 from last almost 10 months, and we have many questions. So just what we will do is first of all we'll go through, I would like Ramesh sir to talk about the chapter, and then we'll proceed to the next event.
Thank you. Good evening, ladies and gentlemen. A very warm welcome to all our participants from the Chennai chapter and other chapters of IIT Bombay, as well as the faculty and students of Presidency College and members of Prabodhan Sansthan, an NGO from Maharashtra, who have also collaborated with us for this event. Due to COVID restrictions in the last few months, we were not able to have our normal activities in the chapter, in Chennai chapter. Therefore, 2 months ago, the executive committee decided to do an eminent speaker series of talks. And today we have the first talk in this series, which is on COVID-19, the way forward, by Dr. Prabhdeep Kaur, who is the head of the Division of Non-Communicable Diseases at ICMR. She's been with the COVID situation and monitoring this for a long time, and has really in-depth knowledge about what is happening in India, and therefore is the ideal person to speak on this subject. I would also like to thank the principal of Presidency College, as well as Professor Gautam, who is the head of Department of Geology, with whom we are collaborating so that the faculty and students of the college can also benefit from these eminent speaker lectures and gain from this experience. And Professor Gautam has been very helpful to get everything organized at short notice. And they are also part of this program, and we are grateful to them. We are also collaborating with Prabodhan Sansthan of Maharashtra, who were very kind to provide us a link for this meeting, because originally we thought there would be 100 participants, but we already had 150 registrations yesterday, and about 100 people from Prabodhan Sansthan are expected to join today. So we didn't have the facilities to do on Zoom. So they were kind enough to give us the link. And their members were also keenly interested to understand from Dr. Kaur about COVID-19. So we thank them for all their help. And I would welcome the speaker and request Sai to do the introduction for the speaker. Sai?
Yeah, thank you, Ramesh sir. Good afternoon, everyone. And I'm deeply grateful for Dr. Prabhdeep Kaur for accepting the invitation on behalf of the IIT Bombay Alumni Chapter here in Chennai. Just a few words of introduction. And Dr. Kaur has had an illustrious career in epidemiology. And I just wanted to say a few words about her before we get started. Dr. Prabhdeep Kaur is a physician and public health professional in research, teaching, and practice of implementation of science for scaling evidence-based public health interventions and policies in healthcare system. Many of you that would have watched the television over the last few months, as well as in the papers, you might have seen her. She has dual training in internal medicine and field epidemiology, and she's currently Scientist E and head of the Division of Non-Communicable Diseases at the ICMR-National Institute of Epidemiology. She's also the course coordinator for FETP, Non-Communicable Diseases, track fellowship in Epidemic Intelligence Services India for the Southern Hub. And she's a member of WHO's Global Cervical Cancer Elimination Expert Committee. And as you know, she's also a member of the Chief Minister's Expert Task Force on COVID-19 control in Tamil Nadu that has been advising on the lockdowns and how to bring the economy back over the last several months. She has over 16 years of professional experience with focus areas including implementation science for the non-communicable diseases interventions, outbreak investigations, infectious disease surveillance, epidemiological research for various NCDs, and public health education. She's a principal investigator for the India Hypertension Control Initiative, which is a multi-partner implementation science project, which aims to improve hypertension treatment and control in 100 districts across all Indian states. She's conducting epidemiological studies on COVID-19 in Tamil Nadu and technically supporting implementation of public health strategies for COVID-19 control in Chennai and Puducherry. I could go on, but I do not want to take any more time from this. Really happy to have you here, Dr. Kaur, and thank you once again for accepting our invitation.
Thanks for the opportunity, and I'm excited to interact with very different kind of audience. So I will try to sort of talk some of the fundamentals, and I'm not sure because the audience is very diverse. I wasn't very sure what kind of areas might be very basic for some people, whereas new for others. But of course, I have gone through some of the questions, and I'll be happy to answer more questions as well. So the topic, when I spoke to Mr. Sai, he suggested was that we all know so much about COVID. We are all the time reading newspapers, watching TV, and reading a lot of things on social media. So what I thought I'll just be doing is just in the beginning, a small introduction, and then focusing on 5 or 6 areas wherein I'll give more emphasis to what we can do going forward based on the science and the knowledge that we have gained in the past 8 to 9 months. And although it is such a difficult epidemic, we have learned a lot very, very fast. The progress has been extremely fast in various areas of understanding this disease. So why is it so different? Why is COVID so different from other epidemics? We have seen so many epidemics over thousands of years, but this is the worst epidemic in the last 100 years. One of the issues which makes COVID very difficult to control is its high transmissibility. It spreads really fast. And unlike many other respiratory viruses, it has a very long incubation period. It is able to go from one person to another over a long period of time. It has an asymptomatic transmission, which makes it extremely challenging. There's a duration during which a person, even before the onset of symptom, can also transmit it to others. Spectrum of symptoms. There is no classic symptoms. People can have very vague symptoms and yet have COVID and not have symptoms at all. And then the symptoms seem to persist for a very long time, even though infection comes down, but the symptoms seem to last for a very long time beyond the phase of infection. And of course, as of now, we have some success, but we are yet coming out with effective treatment and vaccines. So that's what makes really this epidemic very different from others. Now, you all know about symptoms of COVID. I'm sure you have come across that. So the commonest symptoms are fever, cough, difficulty in breathing, very interesting symptoms like loss of smell or loss of taste, which are very classic for COVID. Then some people can also have diarrhea, vomiting, and very importantly, the tiredness and the body pain. And at times that is the only symptom. There are people who have no other symptom, but they say, I just feel very tired. So one thing, like we say, if you are a healthy adult and you are very active, and if you feel unusually tired, get yourself tested for COVID, because If you're unable to do your routine activity, which you thought were very easy for you to do, you need to rule out if you have COVID. So it's a very vague disease, which makes it very difficult to detect and very difficult to control. Now, what worries us even more is the fact that more and more data from all over the world is showing that the symptoms do not just go away. So if you look at the left side, the darker bars tell you that these are the symptoms which happen when people have the disease. And the right side bars tell you that the symptoms actually last for a much longer time, even though the infectious phase is over, which means that it's not just about infection, it's also about the actual recovery, which takes much, much longer time. And we have learned, one of the important things we have learned over past several months is that although COVID is primarily a respiratory disease, but it affects many organs. And that's the reason it is, we feel it's much more serious than what many people think it is. It can cause very long-term complications to your heart, to your brain, kidneys, liver, GI tract, and also some kind of skin manifestation. So we are especially concerned about the problems in the hearts and vascular, what we call as vascular manifestations, such as people have an increased tendency to get clots in their legs, especially if they are diabetic or smokers, people having tendency to develop long-term heart problems, which is truly a matter of concern. So this whole thing of, it's okay to get COVID, and thinking that just because you're young, just because you're healthy, it's okay to get COVID. No, it's not okay to get COVID, because even very young and healthy people can have one of these complications, which can give them some sort of a long-term impact and also limit their activities for a very long time, even during the phase of illness. Now, coming to the most important issue, how does it really go from one person to other? I think this is really important to understand. Primarily, it is a droplet transmission, which means that when we cough, when we talk, when we sing, we let out some droplets, and this is how it goes from one person to other. In the recent months, one of the most important areas which is widely discussed in the academic circle, also in the media, is the airborne transmission. It really means that, okay, fine, even if I'm not next to a person who is kind of coughing on me, can I still get it in a setting where someone might have coughed and the particles are still remaining in the air? So it is important, but what we feel is it's more important, and the evidence shows it's more important in healthcare settings. It's also important in settings where you have very poor ventilation, closed settings, places like gyms, or where you are singing, like this choir singing, settings where it's likely that the droplets are going to be in the air for a longer period of time. And especially if the people on the other side are not wearing masks. In these settings, the airborne transmission can play an important role. Fomite transmission continues to be one of the mode of transmission. However, most of the data indicates that majority of the infections happen due to droplet transmission, and very small proportion due to fomite transmission. Again, fomite transmission is important in healthcare settings where you are handling patients and where you're handling objects which may have patient secretions. And in outdoor settings, of course, if you're doing good hand hygiene, you can really prevent getting it from the fomites. And last but most important thing which we all worry about is really getting it from asymptomatic. Can we really get it from someone who doesn't even have symptoms? I think that's a very important question. And yes, the evidence shows you can, although the chance that you can get from asymptomatic person is much less than a symptomatic person. And a lot of asymptomatic transmission happens in the households, in the family, where you are very close to the asymptomatic person for a long time and you're not likely to wear mask. So somehow, although right from the beginning, we have been talking so much about COVID and countries have done lockdown, but we are always underestimating the virus. We are just hoping it will go away. We are just hoping that it's not going to hurt us. And everybody feels somebody will get it, but I will not get it. So there's a very low risk perception, except in few groups like elderly who are more concerned about it, or people who have chronic diseases tend to be little more serious about it. But in general, there is always a sense of complacency, which is now even getting worse. And people perceive that I'm not going to get it. But I think we just can't take this virus easy. It's here to stay, and it's got huge impact, not just in India, but every country around the world. So if you look at this very interesting data, which tells you the real impact of COVID. So around the world, and these are multiple countries with different levels of health systems, we have just so many excess deaths, what we call as the missing deaths. We don't know whether these people died of COVID or not, but we know for sure that if you compare deaths in the peak of COVID months in any country to previous months, you find that there are a lot more excess deaths when you have a COVID epidemic as compared to previous years. Some of these could be COVID deaths, and some of these could be deaths because people are not able to access the health system, and therefore they may not be able to get treatment, adequate treatment, even for other ailments. So it's the impact of COVID is not just what you hear as number of cases and number of deaths, but much beyond that. And very interesting similar data from India, which was came in the newspapers from the Mumbai Corporation, wherein they said that city has seen many more deaths as compared to previous years. So this excess, we don't know exactly, more than 4,000 excess deaths, whether they are due to COVID or maybe due to other health system challenges. So considering that it's a disease which has huge impact, affects almost everybody in one way or the other, and has the potential to cause a long-term illness. What is that we can do going forward? Although we have learned so much, there is a lot of gap between what we know and what we are doing. And a lot more we can do, which is in our hands to improve the COVID situation in our country and everywhere in the world. So I will be talking more about these 6 things that we have, okay? So increasing the use of masks, looking at multiple intervention, not just one, how we can combine all of them, sustaining what we call as a test, trace, isolate strategy for a long time, at least for next year for sure, shifting from lockdowns to more focused restrictions, expanding the availability of treatment, and the way forward with the vaccines. So the first and most important is masks. I really feel that this is the cheapest and most underutilized intervention in India and in many other countries around the world. So I'm sure you all have got this WhatsApp forward or on social media. So there seems to be, despite the fact that we have so much understanding now that masks are important, many people are not willing to use masks. Maybe they don't understand the science, or they don't believe in it, or maybe they believe in magic. But long and short of it, we are not masking enough. So the evidence of that, this was a small study that we did in Chennai, and we looked at about 3,600 people in various parts of Chennai, in about 60 different points. And we found that in slum areas, 56% people didn't wear masks, and in non-slum, 43%. But what was very striking was also that there are about these 20% people who seem to wear masks, but not on their nose and mouth, which means it's not going to be effective. So even if you wear a mask, you're not protected from the COVID. So this is a major area of concern. And I think wherever you are, whichever organization you work, whether you're a student, whether you are an employee or employer, you should really implement what we call as a universal masking policy. And there is now enough evidence that that's what is going to work, even more than vaccines for now, because it's going to take very long time until we get everybody vaccinated. But if we have masks, we can go back to doing most of the activities in near normal way. So this was a very interesting study, which was very recently published. As you can see, in a particular state, they had these mask mandate. And some of the counties accepted that mandate and the others did not. And it's pretty clear here that the counties which followed the mask mandate had 6% decline, and the ones which did not actually had increase in cases. So more and more evidence emerging from all over the world that we need to use masks. We need to use masks everywhere, all the time. The moment you step out of the house, you have to have your mask on. And then this is a common question I get: what type of mask should I wear? So you really have many options now. So earlier of course, we recommend surgical mask, which is the best option, which is basically a 3-layered surgical mask. But for many people, it's not possible to buy, and also everybody need not buy. So even if you can access a good multi-layered cloth mask, it has to be multi-layered. That's the important thing. It should have 3 layers, and there are certain specifications which WHO has also given, that what kind of mask is, what kind of cloth materials can be used for making multi-layered masks. These are the kind of masks which are effective, and they need to be tightly woven, and they need to have good fit. So the structure of the mask should be such that it completely covers your nose and mouth. Now, if you cannot get that, the next best option would be to at least wear a single layered cloth mask. But what is not recommended is what you can see here, the knitted mask with the holes in it. And sometimes just, tying a kerchief cloth, that's not effective. So you have to have a proper mask. And if you have a workplace setting, it's really important that you either provide or you ensure that people always come in with a mask. Now, coming to the second part, which is we cannot control this virus with any one intervention. That's what we have learned. And going forward, what we feel is that every setting need to have multiple interventions. So you need to do many things at a time, and that's called the Swiss cheese model. So what it means is that every single intervention, if you just do it alone, it has some loopholes in it, and it's not fully effective. But if you keep adding one after the other, then your effect increases. So as you can see here, so you do social distancing, you add it with good ventilation, then you add it with mask, add it with hygiene, good testing, contact tracing. If you do all of this together, you will be able to control. So it's important to remember that no one intervention is going to give you 100% results. So irrespective of what the setting is, you really need to do multiple interventions. And in context of workplace, I just wanted to emphasize that you need to really implement all these multiple interventions in your workplace. And most importantly, you need to really have institutional guidelines. You need to have somebody who is monitoring these guidelines, either in the form of a committee or some key people, nodal persons. You need to make sure that all your staff who have COVID-like symptoms have someone to go to report. They should be given fully paid sick leave for the period that they have symptoms. And also, if they are contacts of someone who has been diagnosed with COVID, they should be given fully paid sick leave. And you need to make sure that the whole workplace setting has ways. I mean, it should, the workplace setting has to facilitate that people should be actually able to follow these kind of practices. Quite often we find that, employees are willing, but the place may not be conducive for a COVID safe behavior. For instance, how you place the chairs, how you ventilate your rooms, because we know now a lot of offices are fully air conditioned and fully closed. So a lot of these structural changes, engineering changes are required. So we see these challenges, people may not be comfortable wearing masks for long hours. There are places, offices where social distancing cannot be done. And one of the biggest problems is people don't report mild symptoms. So we find that's one of the reasons why the COVID spreads. And now that most people have gone back to work, this is really important. People need to report mildest of the symptom, just any cough, any fever, any tiredness, any minor symptom should also be reported. And many of the clusters that we have investigated, we found that everything is done very perfectly in the office, but the transmission happens in the lunch breaks. And that is the commonest place where you can get COVID, because that's when you remove masks, people tend to sit in the groups, and then all the other precautions are just completely forgotten. And that's where the transmission takes place, even in offices and in the big stores, which have very, very good systems in place. Lunch breaks can cause COVID outbreaks. So you need to make sure that people don't eat in big groups, the chairs are kept apart, and they even if they want to sit and eat together, they're not very close to each other. And of course, avoiding group meetings, minimizing meetings, and using online meeting as far as possible. Now, the next most important is really sustaining what we call as a test, trace, isolate strategy. So although every state has implemented this strategy at two varying levels, depending on the resources that were available, depending on the healthcare infrastructure and many other factors. But what we find now is that everybody thinks, okay, I think COVID, the first wave is coming down and it's going to go away, so we can take it easy. We cannot take it easy. If the thing with COVID is the moment you take it easy, it will come back. And you have seen that in many European countries where they did excellent control in the summer. And after the summer, as they relaxed their restrictions and as people started taking it easy, going for holidays, not wearing masks, they have got resurgence. And in many countries, as you know, now the second wave is actually bigger than the first wave. Of course, because we are detecting more, but also because the people were really back to normal, doing everything the old way and not what we call as the new normal. So I'll just say a few lines about each. I don't know, some of you may be very familiar and others may not be. But of course, if it's too quick, then I can answer some questions in the end. So this is what we call as a public health strategy. There are four corners of how you are going to control COVID: surveillance, testing, isolation, contact tracing. And what is very important to remember is it's not just that public health system has to do it, government has to do it. You can do many of these in your own setting, in your office, at your home, and in wherever you are. For instance, surveillance, of course, surveillance is to find cases, but you can, if you have your own workplace, you can have a team which does surveillance in your own office. And similarly, you can have system wherein you do contact tracing for every positive case you get in your workplace, and also ensuring that people who get diagnosed, they actually follow the isolation and quarantine guidelines. And I'll explain a little about each of these four pillars. So the first is really finding who has the disease or who is likely to have the disease. So this is a person who has any symptom or has been in contact with someone who had symptoms or who has been diagnosed to be COVID. We need to find these people where they are. And it may look very simple, but it's not easy to find these people because quite often we find people don't take symptoms seriously. They stay at home. They tend to keep on doing their normal activities. They keep on going to work. They sometimes attend weddings. And they think, no, I just had a mild cough, so I didn't think there was any need for me to stay at home. So finding people who really have symptoms, making sure that everybody around you is sensitized and they report early. So that's really important. And we need to continue doing this. And all the, of course, health systems have places where you can go, like in private labs. There are government hospitals, like in Chennai, they have what we call as fever camps. So Chennai Corporation actually has 500 points in the city where they send a team where you can go and report your symptoms. They take your sample or they take you to one of their collection centers and do all the tests free for you. And they also test all your family members if you have COVID in these camps. So this is most important. Testing is really the most important intervention in this particular epidemic. And if you remember, when we started hearing the stories of COVID from China, China scaled up their capacity to test so fast. They have capacity to do now millions of tests in a day. And for every time when they got a resurgence, they have taken a very aggressive approach. They just test everybody. I think you all are aware, we had a huge market outbreak in Chennai, what we call as our big vegetable market, Coimbatore market. A similar outbreak happened in China, and they tracked everybody who came to that market, every vendor, lakhs of people, and they just tested everyone. Because testing seems to be the best way to stop this virus. Given the fact that asymptomatic people can have it, people with mild symptom can have it. So you really cannot depend on people to report. So once you have an outbreak, you really need to test very aggressively. You need to test not only symptomatic, you need to test contacts of people who got diagnosed with COVID, irrespective of the symptoms, which is really important in this outbreak. Unlike all the other diseases that we manage, this is a very important component of COVID control. And the RT-PCR, as you know, is a gold standard, which is now provided in a lot of government and private labs across across the country. Next most important thing is contact tracing, and this is again a very underutilized intervention. And if you do it well, you can stop an outbreak in your office, in your workplace, and in your whatever setting, in the community, in your residential area or complex. This means that, as you can see, COVID spreads from one to multiple people. And if you can get a list of all the people to whom this person who got COVID might have met, then you can easily test all of them and stop the virus from going further. And if you fail to do that, the virus will just continue to spread very, very fast. So there are two types of contact. One is your family member, and second is people whom you may have come in contact with either at work or during travel or anywhere else. Suppose you went for a wedding or you went for any other event. Now, what is very striking about COVID is that you need to not only look at people whom you met after you got symptoms, you need to go 3 days backwards, because the COVID can transmit even before you got symptoms. So you need to go 3 days backwards, and you need to think all the people you met 3-4 days before you got symptoms. And that's the list of people you need to report to your health authority so that they can contact them, let them know about their risk and test them. So you can transmit to other people, generally we say up to 15 days, and most of the transmission really happens in the first 1 week to 10 days. So that's the time when you need to think who are the people you were with during that period. So it means really thinking through all those activities you did, where all you went, to whom all you met. And it means that you have to also think whether you were really in contact with that person very close. See, for example, somebody asked me, okay, I got COVID and this milkman came and dropped milk outside my house. So is he a contact? No, because you didn't spend any time with that person. So you should have spent nearly 10 to 15 minutes in less than 6 feet. We say less than 6 feet distance. That's when your risk of passing on the COVID increases. Sharing food, sharing office, and staying in the same household, of course, are important risk factors. Now, lastly, coming to isolation and quarantine, what isolation is for positive and quarantine is for negative but exposed. People who do not currently have COVID, but came in contact with somebody who had COVID. So they need to be under quarantine, and anybody who had COVID need to be isolated. So I'm just going to move to the next issue now. So again, just to summarize, the public health strategy has to continue all through 2021. It has to continue within our health system, and it has to continue in the workplaces, because even if, as I'll talk about it a little later, we get vaccine, it's going to come in a phased manner. And until then, we do expect clusters to come. And for every cluster, we have to apply aggressive testing, contact tracing, and isolation strategy to make sure that we suppress the virus and we don't let it go beyond those boundaries. Now, next, this is most important thing we have learned in the last few months. We don't need to do lockdowns. We have learned that we can actually achieve the same effect without doing lockdowns by doing more focused restrictions and by using masks. So I think I'll spend a little more time on this because this is very important. And also I find many questions coming in this area. What is that I can do and what is that I cannot do? One thing is that now, unlike earlier when the governments were not very clear how much is the spread, so they had to just close down everything. Now what we have moved to is, globally there is what we call as a graded approach to closures, that you don't need to close everything at the same time. So you can have levels of alert. So many countries like New Zealand has 4 levels. This is one example. And every country and state can have their own alert system. But the point is you don't need to shut down everything. You need to assess the situation. And depending on that, restrict certain activities. So for instance, alert level 1 is really the best case scenario. And if you have few cases, but you know from where they came, like you know that they all are from one office, they all are from one building. So that's a moderate risk situation. As you move that you have many cases, you don't know from where they are getting infection. Then that is your level 3. And level 4 is when you have cases coming from all over the city or all over the state. And that's when you need to do most stringent restrictions. So you can tailor your restriction according to the level of spread. That's one thing we have learned. The next thing we have learned is all settings are not equally dangerous. So there are some settings where you are more likely to get COVID than others. So if you are in your house with just your family with whom you regularly live, so that's the lowest risk setting. And on the other extreme is the highest risk setting, which is where you are in a closed setting with people whom you don't know and you don't have any kind of ventilation and people are sitting relatively closer. So that is the highest risk setting. So I'm sure you all can think of a wedding, which is, now it's a wedding season. I find I get 2-3 invitations every week and I wonder, how people make these choices of going or not going. But I would think a wedding hall as one of the highest risk settings. So you need to sort of grade your risk according to many criteria, which I'll talk about little for this next few slides. So in between are the two kinds. So you can do outdoor activities. Outdoor activities are relatively safe, especially if you are alone and you're not with many people. If you're doing outdoor gatherings, you need to make sure that you don't have too many elderly with you and people are wearing masks. And if you're with them for a longer period of time, you need to make sure that the distancing is observed. But the point is that all activities are not equal and we need to understand what activity we are doing and then make decisions regarding whether it can be done or not. So this is very interesting. So even in indoor settings, if you are using masks, you can reduce the risk of transmission. So this was very important investigation which was published by CDC, wherein they showed that there were 2 hairstylists in a hair salon who were with 139 clients. They did, but they always wore masks. So both of them were positive. None of their clients got infected. So what it tells you is that even in a closed setting, if you are wearing a mask, you can prevent the transmission. This is the most important thing for India, I think, gatherings. We somehow have now started thinking that COVID is gone, so we can go ahead to doing weddings, meetings, and other. I also find not just wedding, the small family gatherings. And I would really caution you against it. This is a very, very dangerous area we are getting into. And going forward, I think we should not plan any big gatherings, meetings, at least for next year or next 6 to 8 months for sure. The reason is we have learned so much from all over the world that the gatherings can be a starting point of a huge outbreak. So this is just one example. If you look at, there was a wedding reception which led to 27 cases in a local community, so many cases, large number of cases in a long-term facility and all over. So what you think, okay, no, it's just few people coming together, right? Just few people, but then to who all they will go and meet and with who all they will interact. And it's very unfortunate. It led to 7 deaths. And actually some of them had not attended the wedding. So without your knowledge, you may be transmitting disease to people who are very high risk. And you may think, no, I'm a young person, I can go and attend wedding. But you may have a person in your house who is elderly or someone who is even middle-aged, diabetic. And in your office, maybe your colleagues, maybe your boss, you may be transmitting to them. So gatherings will be high risk for the time to come. So we should not plan big gatherings. If you're planning family gatherings, keep them small. Try to do them in open places. If you have a kind of veranda or something in your house, do it there. Make sure windows, if you're doing it in a hall, keep your windows, doors open, keep the distance and wear masks. And if you're eating and you have to remove your mask, make sure you don't sit too close to each other. And this is another question people ask, can I travel? Can I take flight? It's not 100% safe to fly, but what we are learning is that the air travel might be safer than what we thought earlier. So the risk of contracting COVID in air travel is not very high, provided it also depends where you are doing the travel. So if you are doing the travel from a city which has high sort of burden of COVID, or you're flying into a city which has high burden of COVID, which means that people who are in that flight are more likely to be exposed, then your risk is high. But if you have low transmission happening in your area and you're going into a place which also has a low transmission, then your risk of getting COVID in a flight is very low because of the way airflow is designed inside the aircraft, and also because the special kind of filters are used to make sure that infected air doesn't circulate. So this is what I find. I know it's a bit complicated chart, and I'll try to explain a little more. So risk is not equal everywhere. That's the most important thing we need to remember for 2021. For every situation we get into, we need to ask few questions. And I'll be explaining this a little more because this is hard to read. So I just broke down this chart in two parts. So we need to look at, okay, I'm getting into a setting. How long I need to be there? Is it outdoor or indoor? Will people be wearing masks there? Will there be a crowd? What will I be doing? Whether I'm silent, talking, singing, or shouting. So these are the 5 things you need to assess. So if you look at this chart here, you find a lot of reds and a lot of yellows. Means if you are going to get into any setting where people are not wearing masks, you are more or less having moderate to high risk of exposure. And the only setting where you can be without mask is really outdoors, well ventilated, less crowded. That's the only place you are safe without mask. Apart from that, without mask, you have the risk everywhere. And as you can see here, as you move from low occupancy to high, less crowded to more crowded, and as you move from a setting which is outdoor to more poorly ventilated, your risk will continue to increase. So this is if you are not wearing a mask. Now, what is interesting to see is how this chart changes if you are wearing a mask. If you wear a mask, you can make many of these activities much safer than what you thought earlier. So most of the activities which are, if the place is less crowded and you are there for a shorter period of time, you are fine with mask. But if you are in a crowded place, even with mask, poorly ventilated for a longer time, your risk increases. So these are the questions you need to ask. So suppose I have to make a decision whether I should go to a particular meeting, go to a particular wedding or not. You need to think how long I need to be there, where is it going to be, whether everybody will be wearing masks, will it be too crowded? So crowded, I think out. We should never get into a place which is crowded. That's one thing for sure. You should never get into a place where people are not wearing masks. These are the 2 most dangerous things to do. And especially if it's an indoor place, which is closed and which is poorly ventilated, which means most of the big gatherings will continue to be very, very unsafe for the year to come. So around the world now, they are actually making more what we call as, focused restrictions, depending on understanding of this transmission of virus. So this is just an example I took, wherein the countries or the states choose which activity I should stop and which I should not. So for instance, you can see here, this is from one of the states in US, wherein they had a resurgence, and what they stopped was theaters, high schools, workplaces where work from home is possible, restaurants, bars. Restaurants and bars are very high risk, especially the restaurants which have only indoor dining and distancing is not possible. So you can do very, very, what we call as, focused restrictions rather than just closing everything. So we would see this happening over next 1 year. The cases will increase, cases will decline. And accordingly, we may find that certain activities will be permitted and certain activities will not be permitted. But let's hope that we will not have another lockdown where we have to stop everything, because we understand a lot more about how to stop the transmission or slow down the transmission of this virus. The next most important thing is making sure everybody gets proper effective treatment. So we didn't know anything about the treatment when this epidemic started. And as you know, there's been rapid progress in the knowledge, so many clinical trials, so many medicines have been tried. I'm sure you've read lots in the papers and very confusing. Then suddenly they say something is working, something is not working. So the reason is that, since when the COVID came, many treatments had to be tried because there was no clear-cut answer. But now we have had very good clinical trials which have enrolled thousands of patients around the world. And we know what kind of treatments, at least we know for sure what doesn't work. We are beginning to learn what works. So if you are a person with mild symptoms, low risk, your saturation is normal, you need only a home isolation. You need to make sure you don't pass it on to others. But all you really need is rest, hydration, good diet. You need to monitor your saturation. If you have a low saturation, requiring oxygen, requiring hospitalization, what doctors will give you depending on your scenario, the most effective treatment that we know as of now is steroids. It's a special kind of steroid called dexamethasone. And the other drug, which we have been using for some time now, remdesivir, but the recent data from WHO suggests that it may not be so effective. And now it is, again, there is a lot of debate on whether it should be there in the treatment guidelines or not in various countries. And of course, the third category is critically ill, where you require very high-end treatment. But what is important is making sure that everybody who develops any kind of severe symptoms requiring hospitalization gets into the hospital quick. That's the crux of it. So if you get into the hospital fast and you have access to oxygen and steroids, you can save so many lives. And that's why you see with the second wave now, we have much less deaths as compared to the first wave. Even if you see in a lot of Western countries, cases are more, but the proportion of people who are dying are less because of this, because now you know you need to get in people into the hospital quick, you need to give them oxygen fast, and you need to give steroids, and you can save so many lives. And I'll come to the most important and the last point, which is vaccines. I think everybody must be wanting to hear about this. So why do we need vaccines? So vaccines are really built on the concept of what we call as herd immunity. So what is herd immunity? Herd immunity is for any disease. For example, I'm sure you all got DPT vaccine, you all got polio vaccine, you got measles vaccine. We would like to have majority of the people with some sort of protection from a particular virus by using a vaccine. So vaccines are the way you actually develop herd immunity. But in this pandemic, many times the herd immunity has been used in a very wrong way. So this is how it looks like. So for example, if you have a new virus like COVID and you don't have vaccine, on the top you can see all blue, right? So if no one is immunized and if one person gets, everybody will get it. But it's not just for COVID. Even if you have measles and you're not vaccinating children for measles, it's spread. One child will get in the class, the whole class will get. So that's when you don't have any herd immunity. The second scenario is when some people have immunity from natural infection. Means like some of us got COVID, like in a city like Chennai, as per the last survey we had, 32% of the population roughly had COVID. Similarly in Delhi, and all the cities have had about 30-35%, but rural India, it's very less than 10%. And the other cities are somewhere in the middle. So few people have it, and you can see. So the ones who have will not get it, but the rest will still continue to get it. Now, the third case scenario is the best case scenario, which we want to have with vaccines, wherein nearly the whole population is immunized, and therefore no one gets the vaccine. The issue with herd immunity is many people started propagating the fact that, oh, you let the disease spread, many people will get it, and we achieve the herd immunity. So it's not the way it works, because you need to nearly have 70-80% of the people. And that's not an ethical decision to make, because it just means that you're going to lose millions of people before you reach that 70-80%. And you cannot let it happen in our current context. And therefore, we have now the scientists from all over the world very strongly feel, the public health experts, that the herd immunity can never be a strategy for any country or for any state. We must do all the interventions we can to suppress this virus. And there are countries which have even made sure that they don't get resurgence, like New Zealand and many other countries. So now coming to the vaccine. So normally the vaccine development takes several years. It has to go through 3 steps, what we call as phase 1, phase 2, and phase 3 trials. And each trial has its own specification. So the phase 1, these are the small trials where they will take few healthy volunteers and try to understand whether a vaccine is safe, whether it works or not, whether it has any serious adverse effects. And then you move on to the phase 2, where you look at several hundred people and try to understand if there are side effects, if their immune system is really responding by measuring the level of antibodies. And the phase 3 trial is when you have large number of people participate, several thousands of participants, and you try to measure what we call as efficacy of the vaccine, that what is the chance that a person who got vaccine may get a disease or not. So what is very encouraging is that this process, which takes really very, very long time, the timeline has been cramped, and we have had many vaccines moving to very fast through all these three phases. So if you look at the current status, you already have about 13 vaccines in the phase 3 trials, and even the 6 approved for limited use. So although this is really good news that we are going to have a lot of vaccines, vaccine is not a panacea, because this is going to take very long time. By the time we get to achieve a good coverage of vaccine in the population, we may lose millions of lives if we stop doing things which we know, which I talked about earlier, using masks, public health strategy, avoiding the high risk settings. We need to continue these measures. So when the governments have to take a call whether a vaccine can go into a big program or not, depending on certain criteria like safety, that it should do no harm, if efficacy, what is the chance that a vaccinated person may get infected, and whether it is really available in large number of doses. But what's most important is moving from vaccine to immunization programs. So although we have vaccine, we are likely to have at least a few vaccines in the next few months. It's going to take a while before these vaccines can actually reach everybody, because the immunization program needs much more than just a vaccine. So first is manufacturing these vaccines in adequate doses, then making sure there's cold chain. So I think 2021, one of the big things that the governments will be focusing on is strengthening the cold chain, making sure you have consumables, making sure you have vaccinators. You need people who will have to actually do these vaccination program, your health workers, doctors, nurses. And most importantly, the community acceptance. I know still there are people even now who say, oh, even if vaccine comes, I will not take it. So if a large chunk of the population refuses to get vaccinated, then it's going to be a big failure. And we know that vaccine hesitancy has been a problem in the recent years. We have seen it with measles, we have seen it globally with the HPV vaccine. So although we have very good vaccines, there are people who believe that they don't want to take, and that's a real problem. And then the big challenge of reaching coverage. It's not about you alone getting vaccinated. If you want this disease to stop spreading, you need to have 70 to 80% of the people vaccinated. And that's going to take really long time. So it's a difficult road ahead. We always look for easy answers, but unfortunately in science, we don't have easy answers. And many times those easy answers are wrong. But what we need is the right answers, even if they are complex and it takes longer time. What we need to learn is there's a lot we know about this virus. There's a lot we can do to stop the transmission of this virus, and implement all those scientific strategies and make sure we go back to normal as far as we can. At least we make sure we keep our economy running and we save lives, although we cannot go back to doing all the activities as before. Thank you. Over to
Dr. Prabhdeep Kaur. Thank you so much. I wish we could all be in person, which you said we couldn't do right now, to give you a standing ovation. But close second, maybe I'll clap right here by the microphone and let you know how much we appreciate what you just went through with us today. So a couple of, I guess, thoughts from me, and then maybe we'll see we have questions from the audience, right? Really, really good. If I came into this talk looking for, oh, everything is fine, we can go back to the way we were, well, I can say that I'm disappointed. But you do leave us with a really hopeful way forward, simple and effective, and certainly something that we could all follow. As well as I like the way how you put it, that where we could still have an economy and be safe. So I really appreciate you taking the time and talking with us about this today. So I'll stop here and I'll see if folks on the call, if there are any questions that maybe they want to ask.
Sure, I'll be happy to answer. I try to address many of the questions which you had shared with me. but I'm really happy to answer more. I think one question which I forgot to address, but I'll quickly answer, which was there in your list, was really about immune boosters. People asking whether there are any special foods or special things we can have. Unfortunately, as I said, there are no magic bullets, and there are no specific things you can do or special foods you can take to prevent getting COVID. But maybe the best thing you really have is mask. And if you are healthy and if you have a good mix of physical activity, nutritious diet, and taking your medication in case you have any long-term diseases, getting good sleep, you will be in general in a good health. And a healthy person can take any disease better, not just COVID. So I think it's important not to fall in this trap. I know people have been taking certain powders and drinks and things thinking that they'll not get COVID, but I'm really sorry to say there are no magic bullets. So that was the one I missed, but I'm happy to take more questions, or if there are any questions in the chat box.
Thank you so much.
Yeah.
Harshal, has there been any questions coming in from the chat box?
Yes. So thank you, Dr. Kaur. It's like amazing session, and we had a good session here, and then there are a few questions as we have. One question we are getting is it safe for the senior citizens, so who are above 70, to travel by train? Because now, as we see that slowly lockdowns are opening, and then trains are, then your public transport is opening up. So what do you think about this point?
Yeah, I would not recommend a train travel for senior citizens because it's especially because if it is air conditioned, it is closed, and they are likely to sit next to other people for a long time. So it's better to avoid. I would say travel by your own vehicle. That's much safer. But if you're doing a short travel and it is open, I mean, you're not traveling in air condition and you can make sure that you wear a mask all the time. I think, again, I said, you got to go back to the same thing. Is it closed? Is there a mask? How long you need to be there? You can do that. But long travel should be avoided as far as high risk group is concerned. I would say by anybody, but definitely for people who are at high risk.
Okay, and so Dr. Kaur, so we have another question. So one thing is, we never expected COVID-19. If if anyone would have asked a year before about COVID-19 and about what happened in last 1 year, nobody would have imagined. So what do you think that what can preventive measures we can take, to get to this, new epidemics which are, coming, I would say, the out of syllabus kind of thing?
Excellent question. In fact, this is a question that we have been asking. And I don't know how many of you have heard the famous talk by Mr. Gates, where he said that it's not a matter whether there will be another epidemic or not, it's a matter when, right? So epidemics will continue to come. The reason is there is increased interaction between the human and the animal, right? So most of the animals, most of the viruses are actually passing from one host to the other. And we don't know when they jump to humans. If you look at all the recent epidemics in the last couple of years, Ebola, we had the SARS earlier, and we had Nipah virus, which even we had in India. So they all have a common feature. They seem to jump from animal host to humans. And so when there is a interaction, close interaction between the two, there will be a high risk that we will get new viruses. Now, what do you do about it? You need to set up very good public health programs. And now it's like kind of accepted all over the world that if you don't invest in public health, you cannot prevent epidemics. So what these programs do is you should have surveillance everywhere. You should be able to pick up any unusual pattern. You should be able to pick up any unusual symptom, people presenting with any unusual symptoms and anything that's not fitting into the normal picture. And it's not just for doctors to do. What is very interesting is the whole epidemic detection now is considered more of a societal activity. So globally, if you see, there are programs like in Ebola, for instance, they used community. So community can report if something unusual they are observing, someone developing unusual symptom. Now they also monitor social media. So there are many experts and there are many such projects going on wherein they use social media to actually capture any unusual pattern. So if you have these systems in place, good surveillance system in place, good public health systems wherein you have people who can quickly go and investigate and find out, okay, is it something I need to worry about, or is it something I can let go? Fine. Quickly make a decision and then escalate it to subsequent levels. You can actually detect outbreaks early. And we have seen success in many parts of the world where such systems are being tried and they're working. Over.
Okay. Yeah, thank you, Dr. Kaur. That answers this question. So it's like it's not only responsibility of healthcare workers, but it's responsibility of every single citizen to make sure that we don't have such new epidemics. I would say in the
But I
future.
think we need little more education where people
Yes.
know what to look for. So I think what's important, and we did a small, very interesting study in Tiruvallur, which I'll be happy to share with all of you. It's published. We tried to involve community. This was before COVID. We didn't know COVID was coming. But the idea was really to educate people and give them some signals, what we call, okay, you look for in your street, if you find someone has a disease which no one has ever got, too many people are getting admitted to hospital, too many people or two or more people got fever, which is unusual. So things like that, which people can look for and report, and then they should know where to report. So we need to put those systems in place where we call it as unstructured information, can actually help us sometimes detect outbreaks, in addition to structured information, which we'll get through our hospitals, labs, and all of that. Yeah, thank you.
Okay, thank you. So I guess we almost all questions are covered, and thank you, Dr.
I,
Kaur. Yes,
Harshal?
yes,
Yeah,
please.
sorry to interrupt. There is one question that has been actually bothering me, and it was on the list as well.
Yeah.
And Dr. Kaur, I don't want to put you on the spot, but I will ask anyway if you're able to answer. And that is the reports of cases that is being published daily in the media. How much can we rely on that information, considering that either people are fatigued from this and maybe not presenting themselves for treatment or reporting, or the testing maybe going down in numbers?
Yeah. So, I mean, I cannot answer it as, sort of specific to a particular setting, but what I can say is that the whatever you get in media is people who reported or who were identified through some system and got diagnosed. And we know that that doesn't mean all cases. So we know from our sero surveys, right? So for instance, Chennai had 32% people who have had infection or who have been exposed to COVID, and they were all not detected through our media reports. So we cannot detect all cases. Even in best of the countries, even in best of the settings, it's not possible to detect all cases. But the idea is to detect as many as we can. So your ability to detect large proportion of cases really depends on how good your surveillance and testing systems are. So if you take settings, like for instance, if you take Chennai, I would say it's quite good because we have very wide availability of testing, very wide availability of both in the government and private sector, and people can get tested. But same may not be true for, let's say, a remote district in India where people cannot quickly go and get tested. So what media reports tell us is people who had symptoms and who were able to get tested. And it does not tell you all people who have been exposed to COVID.
And thank you so much for addressing that.
Okay, so thank you, sir. I guess we thank you, Dr. Kaur. You almost answered all the questions and which we pre-submitted to you through your talk, and it was so relevant. Everything was covered in there, and we don't see any more questions. So thank you. So maybe now we can move to the next part where Dr. Gautam from Presidency College, HOD of Geology Department. So he will be talking about about the Presidency College and thing. So thank you.
Good evening to all. I'm audible, sir?
Yes, we can hear you.
Yes, thank you. Good evening to all. First of all, I should thank the IIT Bombay alumni members Chennai chapter, especially Sri Ramesh sir, who is having contact with me for a long time, and other respected members of IIT Bombay for giving opportunity to, in association with Presidency College, in organizing this program. I should say that Presidency College is one of the oldest institutions in India. It has in the field of higher education for over 180 years. And I think I should thank you have a collaboration with us for organizing so many programs. One among this today I organized. On behalf of our principal, staff members, alumni members, and students, I should thank all the organizers of IIT Bombay for this wonderful program. Our special thanks to the resource person today, Dr. Prabhdeep Kaur, scientist, National Institute of Epidemiology. And I think she's the right person to talk about the corona and moving forward with corona. You are rightly chosen a person who was working from the day one when corona reached India, especially in Chennai. I could see Dr. Kaur in TVs and all the related meetings, so that she's the right person to talk about carrying forward or moving forward with corona. Thank you, organizers, and thank you, madam, for giving an excellent speech on the corona and moving forward. Madam has shared her experience with studies and that has conducted from the day one the corona started its infection in India and Tamil Nadu. Thank you so much, madam, for sharing your experience to us. And respected, I wish to say to the respected organizers and madam, the Presidency College students are not from Chennai city. They are spread all over Tamil Nadu, and some students are from even different parts of India. And they have got participated in this program, and this especially will be taken to many parts of India and all over Tamil Nadu. I'm sure that it will be taken to many parts of Tamil Nadu. And with the instruction of our principal, I included our NSS volunteers, students volunteers, to participate in this program, so that this message will be taken in a faster rate to the peer groups. So that is exactly the objective of the organizers of this program. So we have made like that arrangements like that. So NSS volunteers has been included, and they will be taking this message to their peer groups. And when I am coming to Presidency College and IIT Bombay collaboration, the Presidency College, especially the Department of Geology, is conducting its third program in its row with collaboration with IIT Bombay. This is the third program today we are organizing. So I expect many number of programs for the benefit of students who are especially from rural background. Most of our students are from rural background. So they will be more benefited like a program like this in association with a pioneer institution like IIT Bombay alumni and their expertise to us. And I wish to express my sincere gratitude to everyone who has organized this program, especially the Chennai chapter alumni and this resource person, again, on behalf of our college and the principal. Thank you so much, sir. Thank you for giving me the opportunity. Thank you, sir.
Yes, thank you, Dr. Gautam, for sharing about the Presidency College. And now we come to the next one. So with whom we have collaborated, that is Prabodhan Sanstha, and we have the members, executive committee members from Prabodhan Sanstha who are there in this particular session. So I would like to invite Mr. Manoj Shirodkar. So he is a successful entrepreneur, and he's from Prabodhan Sanstha to talk few things about what Prabodhan Sanstha and other things too. Over to you, Shirodkar, sir.
Yeah, thank you so much, Harshal. I would like to thank you so much for giving us an opportunity to join hands with the prestigious and intellectuals of the country from IIT and Presidency College, Chennai. It's a great honor for us. It was a very informative presentation from Ms. Prabhdeep Kaur. I'll give some information about our Prabodhan Sanstha. The Prabodhan Sanstha, established in 2005, it is engaged in many social activities across rural and urban areas of the country. Some of the activities that we are engaged in are, we have conducted many workshops and series of lectures on social awareness, health and hygiene issues, opportunities in the field of employment for the students and the needy youngsters, gender equality and social justice, especially for the women empowerment. We have also conducted a drive to sponsor children's education, like every family sponsors at least one child for education from the rural and economically backward classes. We have created a web portal to compile the data of buyers and sellers of our community and bring them on one platform. We have conducted lectures series on Zoom and YouTube in the COVID epidemic lockdown. This was conducted on every evening for successful 10 weeks, and where a lot of people got an opportunity to present their skills and capabilities and what their success stories. That was a big inspiration for the spectators who were the part of this sessions. Then we arranged awareness and training sessions on competitive exams for the young and aspiring students. We have been sponsoring community weddings. We have accommodated the people from rural areas in the industries in the city and arranged for their stay nearby wherever he or she is working. And then a lot of work was done in the COVID times, such as arranging food for the poor and trapped due to the lockdown, then providing free masks and sanitizers, transporting the patients to the hospitals, many such activities. I don't have much time to speak a lot about that, but this is what are the activities of Prabodhan Samstha that we have been conducting for last 15 years. And so thank you so much for making us a part of this prestigious group. And I'm sure there will be many more opportunities for us to listen to various stalwarts from the different sectors of life. Thank you so much.
Yeah, thank you, Manoj sir. So this it's really inspiring to hear about the work which is done by Prabodhan Samstha in almost from last 15 years, and even in this pandemic also, the Samstha has found a new way how they can help the society, and then they're doing that one. So it's really good and inspiring for everyone. So thank you for sharing the information about the Prabodhan Samstha. Now I will hand over the session to Rani ma'am for vote of thanks.
Can you hear me? Dr. Prabhdeep Kaur. Her name itself means the lamp of God. On this day, when Tamil Nadu is celebrating Kartigai by lighting lamps, Dr. Kaur has spread light with her talk. On behalf of the IIT Bombay Alumni Association Chennai chapter, I thank Dr. Prabhdeep Kaur for her timely, relevant, thought-provoking and enlightening talk and responses to queries. We thank her for not only accepting our invitation, but for being understanding and accommodating when we were forced to postpone the event. Sincere thanks to Professor Gautam, HOD Geology of Presidency College, for collaborating with us with a view to reaching out this talk to faculty and students of the college. He has said that he also included the NSS to view the talk. Our gratitude to Prabodhan Samstha. We've just heard about all the great work they are doing. Their committee members, Sunil Nerkar, Suresh Shirude, Prajakta Fakale, and Deepak Yole, for timely collaboration and enthusiastic participation. They were saviors when a last moment surge in audience demanded a larger web platform. The Samstha, I am sure, will spread this talk. Last but not the least, the hard work of all our committee members cannot be left unmentioned. Special thanks to Sai Sethuram and Shivakumar for their efforts at coordination. Thanks to Harsh Malpure for all the technical support, and his wife who is a member of Prabodhan Sanstha. She helped us with getting us this platform. Thank you again, Dr. Kaur, for your talk.
Thank you, everyone. So we can declare this session is over. Thank you.
Yep, thanks, everyone.
Thank you very much. It was a very nice session.
Thank you so much. Thank you.
Very nice session. And can you switch on the video?
Me, sir, Gautam?
Yeah.
Yes.
I think in mine as Harshal, maybe you have turned it off.